With me right now is Dr. Tony Iton, the Vice President for Healthy Communities with the California Endowment. And one of the things that I know you are greatly interested in is education and how that relationship goes from education to being healthier.
Well, education, as we know, is the best ladder to essentially success in the 21st century. And it's the single most important modifiable social determinant of health. So there's any number of data showing that educational attainment level correlates well with life expectancy. And with each step up the educational ladder you go. And there's really actually kind of some scary data right now showing, particularly for white working class Americans and women in particular, that those with low educational attainment are actually dying at really high rates. Their mortality is increasing in an unprecedented fashion.
We know that there is a huge disparity in this country, race, geography, socio-environmental factors. How do we bridge that gap?
Well, the best strategy that we've seen thus far is to actually work at the community level to get at the actual determinants of education, which overlap substantially with the determinants of health. And many of those determinants have to do with essentially the emotional and social health of kids that are going into the school systems feeling traumatized, particularly those kids that are coming from very high poverty communities where there's a lot of stress, there's a lot of trauma. They're bringing that trauma into the school, into the classroom, and if it's not identified appropriately and if it's not essentially anticipated, these kids act out and then they get pushed out of the school. They get suspended, they get expelled, and one suspension, we know, before the 9th grade makes it a third more likely that you're going to drop out of school. So there are things that we can do in conjunction with the school system to work on the social and emotional health of kids to help these kids actually stay in school, stay on track to graduate, and then pursue 21st century careers.
How do you think public health can partner with educational institutions to try to make things better?
Well, I think one of the things to focus on is what I just said earlier, is that health is important in educational outcomes. And our way into the schools is not just around school lunches or physical activity or sex ed. It's also around the social and emotional health of kids and being able to anticipate what those needs are and being able to help the school system design essentially strategies for managing and anticipating the needs of kids that are highly traumatized. Some of those strategies are restorative justice programs, positive behavioral interventions and supports. There are a whole bunch of different strategies that actually come really from the health world that help the education world anticipate the needs of highly traumatized kids and help them advance in that system.
Dr. Tony Iton with the California Endowment, thank you for being here.
Sure, thank you.